I'm Dr. Krishanta Jayasekara, a specialist in internal medicine representing Sri Lanka College of Internal Medicine. Today I'm going to talk on dengue. Dengue, of course, is a very common infection that you see caused by a virus transmitted by the mosquito Aedes aegypti. You need to consider dengue when you have fever and body aches. So it might be difficult at the beginning to differentiate dengue from other febrile illness. During the initial febrile phase, dengue might not differ from any other viral infection. But in rare instances, if you get dengue hemorrhagic fever where plasma leaks out to body cavities, you get a severe form of dengue. You should suspect dengue in an area where dengue is common. If you get fever, severe body aches, vomiting, pain behind your eyes and headache. So diagnosis of dengue is usually clinical. We go by the symptoms, and after the third day of illness, we might do a blood count which might show low white blood cells and low platelets. Dengue antigen would confirm the diagnosis, but it's not mandatory to make the diagnosis, and sometimes it might become negative in late diseases. So we should not rely on the dengue antigen test as a diagnostic tool. If you are suspected or confirmed to have dengue, you need to seek medical advice. A doctor would decide whether you would need home-based care or whether you need hospital admission. During the home-based care, you would be advised to take adequate fluids, monitor your urine output, and you will be advised sometimes to stop the regular medications that are taken for chronic diseases like aspirin. You should also avoid taking drugs like aspirin or steroids for fever. When you are under home-based care, you have to be aware of certain warning signs such as persistent diarrhea, vomiting, faintishness, bleeding, a reduction in urine output. If you get any of these symptoms, you need to go back to your doctor and you might need hospital admissions. You might also be asked to repeat your blood counts during home-based care. You will be advised to admit if you have any warning signs or if the platelet count is less than 130,000. Once you are admitted to the hospital, you would be given frequent medical and nursing care, and you will be advised to measure the amount of fluid that you take and the amount of urine that you pass. So you will have regular blood tests done to check your blood counts, and also it might be necessary to undergo bedside ultrasound scan in the wards to see whether you are developing dengue hemorrhagic fever. Once admitted, you would be discharged in a case of dengue fever once the fever settles and when you are feeling better. In cases of dengue hemorrhagic fever where you have plasma leakage, you might need to stay for a longer time, and till your fever is down, you are stable, you will need to stay in, and the medical teams would decide when you are fit enough to be discharged. So once you have discharged, you need plenty of rest for few days, and you might also be asked to repeat your blood counts. Talking about platelets and dengue, platelet is only a single indicator of dengue. Platelet count will help us to diagnose dengue as well as to decide on admission. Platelet count will not solely decide on the severity of dengue, but a rising platelet count will usually tell that you are heading for recovery. Talking about some native products which are commonly given for dengue patients in certain areas, the only proven therapy for dengue is close monitoring and judicious fluid during the critical phase. There is no scientific evidence in using native products for dengue, and we would strongly advise not to take those native products as a treatment modality for dengue. It's quite important for us also to take measures to prevent dengue. You need to clean your gardens, especially places where clear water can collect have to be cleaned, such as flower pots, gutters, And it's important to take these measures to prevent dengue spreading to your neighborhood as well. Talking about vaccines, there are vaccines given for many viral illnesses. For dengue as well, there are vaccines which have been tried. Dengue vaxa is one of those vaccines which has been licensed in certain parts of the world, but it's not yet licensed to be used in Sri Lanka because it's not approved by the World Health Organization. These vaccines also will not prevent dengue, but it will prevent complications of dengue.